Daily Struggles with ADHD by Marie Darty, Psych 317 Cognitive Psychology, Eastern Kentucky University, Professor Dr. and Sarah. I will be discussing adult ADHD, how it affects an adult, symptoms, and treatment. Adults with ADHD can go undiagnosed because their symptoms can look like stress, anxiety, and depression, and overlap with other psychiatric mood disorders could lead to a misdiagnosis or underdiagnosis for that person. The impaired ability to maintain motivation and complete tasks can contribute to problems with employment, relationships, and self confidence. This reinforces the point that adult ADHD can affect multiple domains of a person's life. I have adult ADHD, and each day can be a struggle for me. I try to keep myself motivated and on task with what I need to do. I'm constantly reassuring myself that I can do this, whatever it may be at the time: family, work, school, cleaning, or even cooking. Some core symptoms in an adult with ADHD can include difficulties with everyday functions of that person's life. These symptoms can include time management, staying on task, problems controlling their emotions, acting out, or overreacting. There is help and treatment for adults with ADHD who do not receive a diagnosis of ADHD until they were adults. These treatments can vary. They can be long term treatments for many people. I was in my early 20s when my psychiatrist finally diagnosed me with adult ADHD. Cognitive behavioral therapy, CBT, is one treatment. A therapist helps you learn coping strategies for everyday life, including helping with organization, emotions, and self confidence. They're even there if you need a shoulder to cry on when you finally realize someone understands. CBT therapy helps with the emotional issues that come with adult ADHD by improving control over one's emotions, restructuring negative thought patterns, and building emotional awareness. These skills can help reduce some of the anxiety and the depression associated with ADHD. Time management is a core component taught in CBT therapy. The components taught in this kind of therapy are associated with improved outcomes over time. Self monitoring is an important step for these components of therapy to work. Some structured skills for time management that CBT teaches: learning to use external supports, planners, reminders, breaking down tasks into smaller steps, and giving yourself specific time to complete them. Review your planner or other reminders often to keep yourself on task. Time management is hard for me. Think of my head as a clock. It never stops. I'm always thinking, I need to do this or that. Before I know it, I'm behind and I feel like I didn't get anything accomplished. There have been times when I have given up for the day and hoped tomorrow would be better. Another treatment that can go along with CBT is taking stimulant and non stimulant medications. These medications are meant to help a person stay more focused on daily tasks and to help with anxiety and depression associated with adult ADHD. Stimulant medications enhance the dopamine transmission in the prefrontal cortex, improving focus and motivation. Stimulants like methylphenidate and amphetamines remain first line treatments for adults with ADHD. Non stimulant medications are useful in patients with comorbid anxiety or a patient who may have a substance misuse risk. Doctors will also prescribe non stimulants if a patient is not tolerating the stimulant medications very well. CBT therapy has helped me learn coping skills that I try to use daily. Taking my medications also help control my ADHD. The nonstop clock that I call my head slows down just enough for me to focus and enjoy my days a little more. At least 80% of adults with ADHD have problems sleeping. The author emphasizes that sleep problems are one of the most common and underappreciated issues in adults with ADHD. Insomnia is noted as being seen frequently in adults with ADHD. Sleep and ADHD are interdependent systems. Poor sleep can worsen ADHD symptoms, and ADHD pathology disrupts sleep. Optimizing sleep may enhance attention, mood, and overall functioning, thereby improving treatment outcomes and the person's overall well being. I take medication to help me sleep, or the clock in my head doesn't stop. Thoughts, ideals, and to do list. If I don't sleep well, then I have what I call a bad next day. Whereas when I get a decent night's sleep, my day goes so much better. As stated in the beginning, adult ADHD can affect every domain of a person's life. Seeking treatment will not only improve your overall quality of life, but can also help you have more good days than bad. I've never regretted getting treatment. My quality of life is now so much better and happier. I hope this has helped you and others understand adult ADHD, symptoms, and treatments, and how this disorder affects all domains of a person's life. Thank you so much for watching and listening to my presentation.